I'm Dr. Kevin Robertson, and today we're talking about non-surgical rhinoplasty, or kind of tweaking noses. And it's an area that's really popular right now. And people are looking for non-surgical choices, and done with the right step, the right tool, and the right surgeon. And I'll emphasize that you really should be doing this with surgeons, because they're the ones that, if you're doing the surgery, you know the anatomy better. I would encourage you not to do that with somebody who's not a surgeon. But the idea happens to be that we can do lots of little things, and the idea typically is, number one, you can use Botox, which most people don't realize, down in some of the depressing muscles of the nose here that help to actually allow a slight rotation of the tip, so you can bring the tip up. Or if people who are those that smile and the tip turns down, you can actually do Botox to soften that. More commonly, though, we talk about it using with our soft tissue fillers, which are soft, they're precise, they're actually reversible if we don't like exactly what they've been able to do. And so as you think about that, think about it that you have to augment with it, which means you have to build up an area. But even though that means that it's a little bit bigger, we're actually adding precision, we're not adding bulk. And so to create lines that are more refined, or to have people where they have a little bump, if we put a little bit of filler both above and below that bump, we can actually smooth out the contour. And although people think that they would think it would look bigger, it actually doesn't. It looks more precise, it looks more balanced. So the most common area that we do is areas that have areas of bumps. People who are crooked, we can soften a little bit of that. Or thirdly, people who've had rhinoplasty before, and if they've got just a little something that they didn't love, that we can tweak just a little bit with fillers, and they get really much better improvement, again, with no downtime, safe, effective, usually about a year or so of duration. So keep it in mind when you're thinking about surgical or rhinoplasty options.